I think when we think about endometriosis, most of us really think about its effect on the pelvic organs. As we mentioned, this endometrial tissue spilling out into the pelvic area, growing into other organs, creates a lot of chronic inflammation. And with the inflammation, scar tissue can form. And as scar tissue forms, that can potentially distort the pelvic anatomy, making it more difficult for natural conception to occur. I think most of us feel that, with an issue that's more anatomic issue, we can address that with IVF, where we just retrieve the eggs from the ovaries, fertilize them, bypass the whole pelvic environment, and just transfer the embryo back into the uterus, and that should solve most of the problems resulting from endometriosis. However, I think one thing that we also should keep in mind is that there are many studies that have shown the endometrial tissue from women with endometriosis can fundamentally have differences that can affect its ability to receive the embryos. In particular, the endometrium needs the guidance of a hormone called progesterone to allow it to receive the embryo appropriately. However, in patients with endometriosis, their progesterone receptors in the endometrium often can exhibit resistance to the effects of progesterone. And when this occurs at a microscopic level, the endometrium may look really nice and thick on the ultrasound, looks great, but from a receptivity point of view, the embryo may not be able to implant appropriately.